Hi, welcome back to lab, and today we are going to be learning about the spinal nerves. So when we look at the spinal nerves, we're talking about some nerves that stay by themselves and some that form those plexuses where the spinal nerves are joining together and then branching back out to form the final nerves which will innervate the body. So the first of those plexuses is up in the neck. It's called the cervical plexus. So this involves the spinal nerves from like C1, 2, 3, and 4. And in the picture on the right, you can see them coming out of the neck area. So on a model picture, they would look like this. And you can see coming out of the cervical plexus that there are a lot of various nerves that are going to go to different parts of the body. And as far as the cervical plexus is concerned, we're only concerned with one nerve, and it's a super important nerve. And that nerve is the phrenic nerve. And the phrenic nerve is going to leave the neck area and it's going to enter the thoracic cavity, go in the mediastinum on the sides of the heart, so between the heart and the lung on each side, and it's going to innervate the diaphragm. And so it's going to stimulate the diaphragm to contract, and that's what allows you to inhale. So the phrenic nerve is what actually allows you to breathe. So that's why I said it's a real important nerve. But that's the only nerve we need to know from the cervical plexus. Just inferior to the cervical plexus is the brachial plexus. And when we're looking at the brachial plexus, these are spinal nerves coming from C5, 6, 7, 8, and from T1. And these are going to leave the neck area, and it's called the brachial plexus because it's going to be going to the upper extremity, to the arm. And when we look at the brachial plexus, leaving the neck area, when it's in the arm, at first it's quite confusing to try to figure out, well, where are the 5 nerves coming off of it? And in order to orient yourself, what you have to do is you have to look in the axillary area. So right here, this is showing where the arm's attaching to the chest. So this is the axillary area. And what you are looking is for this M, okay? And this M basically is showing the origin of 3 of the 5 nerves of the brachial plexus, okay? Where starting medially, this would be the most medial one, that's the one in the middle, and that's the most lateral one. Now, in addition to those 3 anterior nerves, there are going to be 2 posterior nerves. And I'll be showing you those on a different slide because now that I have my red arrow, it's kind of covering them up. Now, looking at this brachial plexus on the nerve model, it's fairly straightforward, but as soon as you put it on a muscle model, it's a little bit more confusing. Students, when they look at this, they think, oh, I can clearly see the M, where you're going 1, 2, this middle one is split, and that's the third, but that would be incorrect. These 2 that are right here next to each other, that's the medial one, that's the middle one, and that's the lateral one. So the M of the brachial plexus is those 3. And now on this view, we clearly can see the 2 posterior one. This is the big nerve that's going to be going posteriorly, and this is the little branch that comes off the posterior nerve. And so those are going to be the 5 nerves of the brachial plexus. So make sure you can see these 5 before we continue on. All right. So let's look at those 5 nerves, and we're going to start with the 2 posterior nerves first. And the first one's called the axillary nerve. Okay. And the axillary nerve basically is going to be innervating the deltoid muscle. As you can see here, it also goes to the teres minor. So it's going to stay up here in the shoulder area. So it's also going to give some sensation to the skin in that area as well. So as far as what the innervations are, I'm going to ask you to look at your list of terms because that will tell you exactly what it is you need to know for this class. So the axillary nerve, essentially, as you can see, is a branch of this other bigger nerve, which is traveling posterior. And that other nerve is called the radial nerve. So the radial nerve, if you look at it on this left picture, you can see that this is the radial nerve. It's not forming part of the M, and you can see that the axillary nerve is coming off of it. On the other side, what you have to notice is the arm has been pronated. It is not in anatomical position. And so the radial nerve, which comes down posteriorly in the pronator, is still going to be on the thumb side. So that's how it's easy to identify. It's the one going right down by the radius, as you would expect. And so this is going to innervate all those posterior muscles of the arm and the forearm. So now let's look at those three nerves that are forming the M, starting with the most lateral of the three. And the most lateral of the three is called the musculocutaneous, which is telling you it's going to muscles and to skin, as they all do. This one stays up in the arm. And the upper picture, you can see how it is diving posterior to the coracobrachialis muscle. But then what happens is it goes in between the brachialis muscle and the biceps brachii muscle. So that tells you that it's going to be innervating all three of those muscles. So it's quite easy to understand the innervation if you understand the pathway. Going back to the M, the middle part, that nerve is called the median nerve. And I want to point out the word is median and not medial. Okay. So the median nerve is going to continue and past the arm, and it goes right down the middle of the arm and the middle of the forearm. And it is the median nerve that goes under the flexor retinaculum in the carpal tunnel and then reappears to innervate a lot of the small muscles of the hand. So you're just looking for something that's going straight down the middle. Okay. So it is going to, when it goes in the hand, not only innervate some of those small muscles, but it's also going to be innervating the anterior surface of the hand for about 3.5 digits only. What's doing the other 1.5 digits? Well, the other 1.5 digits are on the ulnar side, so that is our fifth and final nerve, the ulnar nerve. So the ulnar nerve travels down the medial aspect of the arm, and then right before it gets to the elbow, it dips posterior, and it goes in like the little groove between the trochlea and the trochlear notch. So when you're hitting your funny bone, that's this ulnar nerve that you're actually hitting. And then after that, it comes back down anteriorly and will travel here on the ulnar surface and then innervates that flexor carpi ulnaris muscle and also innervates 1.5 digits both anteriorly and posteriorly. So that's it for the 5 nerves of the brachial plexus. Continuing on below the level of the neck, we're in the thoracic area, and in the thoracic area, every spinal nerve stays. It doesn't form a plexus, and it will travel in the costal groove on the undersurface of each rib, forming what we call an intercostal nerve. And so those intercostal nerves will travel from posterior, and they come around and form anteriorly, and so you get clearly defined dermatomes from that. Below the thoracic area, we're now going to be in the lumbar area, and L1, 2, 3, and 4 are going to contribute spinal nerves to a lumbar plexus. Now, although there are a fair number of nerves that are going to be coming out of the lumbar and sacral plexus. For the lumbar plexus, we're only going to be learning about 2 of them. So I want to point out that you can see the lumbar plexus posteriorly on the left, and then in the picture on the right, you can see nerves diving deep into the pelvis as well. And so the nerves that we are going to be learning from the lumbar plexus are going to be the 2 medial ones. So the most medial nerve is called the obturator nerve, and the obturator nerve will travel in the pelvis, and then it goes anteriorly and goes through the obturator foramen on the coxal bone. which then comes out on the medial aspect of the thigh. So that's going to do all your adductor muscles. And the next nerve, and quite a bit larger than the obturator nerve, is the femoral nerve. And this one does not go through the obturator foramen, but it actually goes anterior to the coxal bone, although it is posterior to the inguinal ligament, but then it shows up in the anterior thigh right next to the femoral artery, which is right next to the femoral nerve. So they go in that order, medial to lateral, femoral vein. So medial to lateral, they go vein, artery, and nerve. Okay. And the femoral nerve then is on the anterior thigh, so it's going to innervate, for instance, your quadriceps and your sartorius muscle, which is right there as well. So that's it for the lumbar plexus, L1 through 4. And then L5 is going to join up with these sacral nerves to form the sacral plexus, which is very deep in the pelvis. And the nerves of the sacral plexus do not come anterior like the nerves of the lumbar plexus did. Instead, the nerves for the sacral plexus are going to show up posteriorly. So on a nerve model, at first glance, it's a little bit confusing because you clearly can see the sacral plexus here, but there is no posterior view. The way that they show is that they show them disappearing behind the coxal bone before they appear here, which you would think is the anterior thigh, but it's actually meant to represent that it's a posterior thigh. And so the one nerve from the sacral plexus is the sciatic nerve, the largest nerve in your body, which we learned previously exits from the buttock area just inferior to the piriformis muscle. So it's a posterior nerve in your buttock, which then in your upper thigh is going to split into two nerves. One nerve is going to go lateral and not go through the popliteal fossa, and that nerve is the common fibular nerve. And you can see the branches of it going close to the fibula. On this left leg of this nerve model, the leg has been externally rotated so that you can see the branch disappearing behind the bones of the leg. And the other branch of the sciatic nerve is the tibial nerve. And the tibial nerve goes through the popliteal fossa and then stays on the medial aspect of the leg. So that's it for the 4 plexuses plus all these spinal nerves, with one exception. In addition to spinal nerves, ventral rami, we also have branches of the spinal nerve that form something called the sympathetic chain in the thoracic area. And what these are, if you look at the bottom left picture where you can see the spinal nerve with the dorsal ramus and the ventral ramus, which is forming all those nerves we just talked about, this one comes off and goes even more anterior and forms this chain of axons and nerves which sit right next to the bodies of the thoracic vertebrae. And this chain is called the sympathetic chain. It's also sometimes called the sympathetic trunk, and your textbook actually has both terms in it, so you're free to pick which term you want. And all along this chain, part of the reason why it's called a chain and not a nerve is because all along its pathway, you can see these little swellings, okay? So it looks like maybe your Mardi Gras beads or a string of pearls. And what each of those swellings is a ganglion, okay? So we have this long sympathetic chain going throughout the entire thorax and in the neck area as well, that has ganglia, which we call sympathetic chain ganglions, each one of them, or sympathetic trunk ganglion. And with that, we are done with the spinal nerve. So I want to thank you for all your hard work, and I will see you again soon.